I want to talk a little bit about bracing. So my oldest son was born with a condition called hypotonia, which means his muscles have lower tone than the average person. So when he was little, he was having difficulty reaching his milestones, and in particular with walking. And his legs worked, he could walk, but he wasn't walking well. And the physical therapist recommended that we put him in ankle braces. And I got to thinking about it, and while the ankle braces were going to allow him to walk better, they fundamentally were going to weaken the muscles that we were trying to strengthen. And I got to thinking about back braces, because back braces are very popular for people who have back pain. And I've come to the conclusion that back braces really are useful for someone who has severe neurologic conditions that would prevent them from otherwise strengthening their muscles. But by putting someone in a back brace, you're actually weakening the core muscles. And the core muscles are fundamental to holding our spines up. In the human person, if you were to take away all of the muscles of the back core, it only takes about 35 pounds to crush the human spine. People think our spines hold our bodies up, but it's really our muscles that do it. And so by going into a back brace, you're decreasing that strength. One could argue that if you put someone in a back brace, they could theoretically get up and walk, they could move, they could work, they could do all those things. And while all that's true in theory, in practice, what people do is they put on their back brace first thing in the morning and they take it off at night. And if they take it off during the day, they have more pain. There are a few people that use back braces appropriately and discriminately. That's not the majority. Most people get kind of hooked on it. They get addicted to their back braces because they feel so good. And that leads to weakening of the muscle and actually making the back condition worse. So that's why I'm opposed to bracing.